USMLE Step 2 CK Oncology Part 4. Topics: chronic lymphocyte leukemia and hairy cell leukemia. So first talk about chronic lymphocyte leukemia. Chronic lymphocyte leukemia is a B-cell disease. This patient could die due to chronic infection, not mature antibody that's cause infection. Etiology: idiopathic. Massive overproduction of the mature cell, but this is not a fully mature and functional cell. So massive overproduction of the mature B lymphocyte in the old person, greater than 50-year-old. Massive amount of B lymphocyte also in the circulation, which progress to cause the infiltration in the spleen, liver, and other bone marrow. Chronic lymphocyte leukemia is a lymphoproliferative disorder. Chronic lymphocyte leukemia is most common to the elderly person in the USA, and so it is the most common among the lymphocyte disease. 30% of the leukemia in the USA is chronic lymphocyte leukemia. Stage 0, it has 5 stages. Increase serum B lymphocyte. In the serum only lymphocyte you will find. Stage 1, lymphadenopathy, and from the bone marrow cell on to the lymph node. Stage 3, stage 2, splenomegaly and anemia due to cancer cell infiltrate the bone marrow, cause the destruction of the bone marrow. Stage 4, thrombocytopenia. Survival time decrease as a stage number increase. Megakaryocyte is the last one to be affected after infiltration of the bone marrow by the cancer cell. So when patient develop thrombocytopenia, prognosis would be poor. Erythrocyte and the granulocyte are the first to be affected after infiltration with the lymphocyte. So red blood cell, white blood cell will be affected first, after that platelet. Clinical presentation: even increased white blood cell, most of the chronic lymphocyte leukemia patient is asymptomatic. Some patients show anemic symptoms like malaise, fatigue, decreased appetite, lethargy, weakness, shortness of breath after exertion. Marked increase in lymphocyte cause the slush cell. Chronic lymphocyte leukemia patient may decrease appetite. Initially, patient is not prone to the infection and bleeding like the patient with acute myelocyte leukemia or acute lymphocyte leukemia. So acute myelocyte leukemia, acute lymphocyte leukemia patients are more prone to get infection and also have a bleeding problem because immature blood cell. As chronic lymphocyte leukemia progress, patient develop anemia and thrombocytopenia due to the bone marrow implantation. Lymphocyte infiltrate replace the red blood cell progenitor cell in the bone marrow. Infection due to the poor function of the lymphocyte cannot produce antibody. So encapsulated bacteria easily can infect. So lung infection like pneumonia can happen. Lymph node enlargement, cervical supraclavicular lymphadenopathy, for example, which may cause uncomfortable in the initial symptom. So most of the time patient is asymptomatic, no adenopathy. So adenopathy is the first symptom, probably will show the symptom, or patient will have anemic type symptom or infection. Splenomegaly, liver enlargement. Diagnosis: CBC. Markedly increase in lymphocyte, 80 to 90% lymphocytosis, leukocytosis. Even the B lymphocyte is high in number. Most of the patient has the hypogammaglobulinemia, which cause to have infection from the encapsulated bacteria. Normally usually have 23 to 33%, neutrophil 18%, for example. Some normal person have neutrophil 57 to 67%. Neutrophil increase in chronic myelocyte leukemia. Chronic lymphocyte leukemia, lymphocyte increase. Hemoglobin hematoplatelet could be low, predict very advanced stage of the disease. Mean corpuscular volume could be normal. Bone marrow biopsy, marked infiltration of the lymphocyte with CD19 marker. More mature looking lymphocyte. Peripheral blood smear, marked lymphocyte where mostly see lymphocytosis and slash cell. Lymphocyte is mature looking leukocyte. Lymphocyte does not have any distinct marker such as specular hue cell as by lobe cell, etc. So no ultrastructure. Leukocytosis, increased lymphocyte, monocyte, smart cell. As the tissue section and the peripheral blood smear, leukocytosis will partially break down due to greater fragility. After find the high count of the lymphocyte on CBC and peripheral blood smear shows some variant lymphocytosis small cell. Next step is to do the flow cytometry of the peripheral blood to confirm the chronic lymphocyte leukemia. Flow cytometry will find the CD marker, which is CD19 for the chronic lymphocyte leukemia. Bone marrow infiltration with B lymphocyte. Patient could have anemia, thrombocytopenia. Sometimes patient could have anemia due to production of the IgG against red blood cell and platelet, but this B lymphocyte does not produce IgG antibody against the infectious agent. Treatment: asymptomatic patient with the stage of 0 and 1, usually no treatment. If patient has mild disease, give chlorambucil. Symptomatic patient as any stage with painful node and or fatigue or stage 2, 3 and 4, give fludarabine and or rituximab. If fludarabine does not respond, give cyclophosphamide. If autoantibody is found in the serum against red blood cell and platelet, give prednisone, usually stage 3 and 4. In chronic lymphocyte leukemia, autoimmune destruction of the red blood cell and platelet are considered as more severe disease than B lymphocyte to infiltrate to the bone marrow. For anemia, treat the chronic lymphocyte leukemia. If this patient has severe infection, give IV immunoglobulin. This patient may not develop small cell. Complication of chronic lymphocyte leukemia: 5% of the chronic lymphocyte leukemia patient could develop high-grade lymphoma, which is called Raster phenomena, high-grade lymphoma. Patient with chronic lymphocyte leukemia develop recurrent infection, pneumonia, for example. Note: lymphocyte leukemia is a chronic lymphocyte leukemia variant. Physical exam show the lymphadenopathy, splenomegaly. CBC show the lymphocytosis. When leukemia lymphocyte produce in marked amount in the lymph node called lymphocytic leukemia. When leukemia lymphocyte produce in bone marrow marked amount called myelogenous leukemia. When lymphocyte produce in the bone marrow, it will increase neutrophil, lymphocyte, basophil. When lymphocyte produce in the lymph node, only lymphocyte will increase, particularly B lymphocyte. Lymph node is the house of the lymphocyte, like the reservation of the army. Bone marrow produce the army. Lymphocytosis. What is lymphocytosis? An excess of normal lymphocyte in the blood or in effusion. Lymphadenopathy. What is lymphadenopathy? Disease of the lymph node. Leukemia, a progressive malignant disease of the blood forming organ. Lymphocyte is non-granular leukocyte. Neutrophil is granular leukocyte. Lymphoblast is morphologically immature lymphocyte. Lymphocyte is simply a production of lymphoid tissue. When serum lymphocyte is greater than 150,000, patient has small cell. Remember, a patient could have greater than 150,000 lymphocyte in the serum still in stage 0. Marked increase in lymphocyte does not mean that patient would have anemia or thrombocytopenia or have symptoms, but most probably to have those symptoms. Next is hairy cell leukemia. Hairy cell leukemia is a B lymphocyte, has cytoplasmic projection, fine hair-like irregular projection. Hairy cell leukemia is a B lymphocyte derived chronic leukemia. Usually happen to middle-aged men. Source of the hairy cell leukemia is the lymph node, and from there hairy cell leukemia infiltrate the bone marrow, develop. After infiltrate the bone marrow, it can cause the myelofibrosis in the bone marrow, and after that it can progress to bone marrow failure to produce the normal amount and shape of the red blood cell, white blood cell, and platelet. So patient gradually develop fatigue, pancytopenia related symptom. Red blood cell deficiency easily become fatigue, functional white blood cell deficiency, infection, thrombocytopenia, bleeding, etc. Decreased neutrophil, monocyte, etc. Less than 20% of the patient with hairy cell leukemia develop the leukocytosis. Physical exam: hepatosplenomegaly due to the sequestration of the hairy cell leukemia. Patient could have very big spleen. Lobe failure due to pancytopenia. Diagnosis: CBC. Pancytopenia has particularly monocytopenia. Decreased red blood cell, white blood cell, and platelet count, which is related to the bone marrow infiltration with the hairy cell leukemia, or bone marrow is dry tap. For some patients, white blood cell could increase leukocytosis. Hemoglobin hematocrit could be low. Peripheral blood smear show teardrop shaped red blood cell. It can happen due to the myelofibrosis in the bone marrow due to the infiltration of the hairy cell leukemia. And lymphocytes have fine hair-like irregular cytoplasmic projection. Bone marrow biopsy. is the most accurate test to diagnose the hairy cell leukemia is the bone marrow biopsy and do the cytochemical test. Bone marrow is positive for the tetrate resistance acid phosphate TRAP stain trap, also called trap positive cell, is important to diagnose the hairy cell leukemia. Bone marrow biopsy also show the reticulin fiber which make the extracellular matrix of the bone marrow where hairy cell leukemia and other cells are entrapped, which progress to have sometime bone marrow aspiration will not find the hairy cell leukemia and bone marrow behave like a dry bone marrow. If an patient develop aplastic anemia, dry trap. CD11 is the specific marker for the hairy cell leukemia. Give purine analog cladribine, which is toxic to the bone, and patient could have neurological and kidney damage.